We are presently in the fifth intake, which indicates that a total number of more than 4,000 have been individuals experiencing various mental health issues. The initiative has successfully engaged over 20 interfaith initiatives and the youth debate and others. Of course, we have some recent plans. When in our period of implementing this program, we've learned that engaging youth to support their peers create ownership in religious groups and leverage their resilience and rehabilitation. We say that local churches and mosques can provide a supportive and environment for drug addicts to openly talk about their addiction and the rehabilitation journey. Mental health in religious communities, insufficient mental health services, mental health professionals, and financial human resources. Leaders in the promotion of health and health initiative with religious communities. Yes, religious leaders in mental health awareness can significantly influence community perspective and create problems. I thank you so much for your attention. Thank you.
Thank you very much, Miriam. I invite Amery.
Okay, there we go. All right, good morning. My name is Amery Delamarter from World Relief. I'm speaking on behalf of our Director of Nutrition and Health, Emily Chambers Sharpe. I'm happy to be here for the Youth Change Agents panel, and then also we're going to be talking about My Health, My Future curriculum, and it targets girls age 14 to 19. So before I go into all the information, I'm going to have you watch a video from one of our participants that's been a part of the program.
Ariko maze kuzigeraho ari ibintu n'abandi batandukanye abahandi abatunazanye baragendana ikaba kwisanzura ndatinyuka rimwe irindi somo twize twashoboye akarima k'igikoni tuvuye kukareba nyine tubona ni byiza cyane ngeze mu rugo nshishikariza nyine mu rugo nabwo kubaka tukajya turya imboga dusuyeho tukagiye kuhira n'abandi nyine abaturanyi nabo bakaza bagasura twize n'isomo y'uko habara ukwezi k'umukobwa nabyo narabimenye ntabwo nari nzi ariko isomo tumaze kwiga narabimenye ifite umukobwa wanjye nawe ndetse mu rugo ndamusangira hari abakobwa b'inshuti zanjye babona nyine tuza n'aho bw'ikirere bikorwa bakavuga gishobora kugira kure ndababwira ati muzaze mungeze muturuke umukobwa barabaganirije bakunaho abenshi muri bo bari bazi ukuntu baje ubona barabizi baba bavuga ati uzi ko turusha ubwenge burya ababwira ati byose tubikesha wowe ubyize isi ririya tsinda ni ryiza biradufasha byadufashije ibintu byinshi nko guteka tutari tuzi twateka sipesiyare tuhavuye no mu rugo turayiteka turamenyana nyine n'abandi bakobwa twabonye ari byiza cyane.
Apologize, it's a little bit quiet, but that's one of our participants from Rwanda. And so we're going to move on to the history of the curriculum. So back in 2017, World Relief was a sub. When we were doing the needs assessment, the Malawi staff were realizing that there was a need for the girls 14 to 19. And so then that development of the program began. And we pulled from a variety of evidence-based adolescent girls toolkits. I put some on the screen, like Dreams, Great, Grow, Smart. So these multi-stakeholders from our team, from the other subs, USAID, and then also government stakeholders were going line by line through this curriculum, developing this, doing interviews, assessments. So then for the delivery of the curriculum, as I said, it's for girls 14 to 19 years old. It's designed to be delivered by a mentor. They're typically 20 to 25 girls. Some of our groups do have 2 mentors. These groups meet for approximately 31 weeks in a location that is considered a safe space, like a church, or maybe the group decides in another area. Throughout the lessons, relevant government personnel such as CHWs, community health workers, child protection officers, victim support are invited to come and share with participants and create linkages to service girls may need access to. So here are some of the objectives. We provide knowledge and skills to make healthy choices about nutrition, increase adolescent girls' knowledge of reproductive health and sexuality, reinforce and promote attitudes and behaviors that will lead to better quality of life for these girls. Also instill skills among adolescents to enable them to overcome the challenges of growing up and becoming responsible adults, including communication skills, decision-making, assertiveness, setting goals, and resisting peer pressure. So I'm not going to go into detail about this, but I did make a card with a QR code with this curriculum that you can look at. So I just wanted to give you a snapshot of what you'll find in there. It has a facilitator's guide and it goes through all of our lessons. And so you also might be asking the question of why we're talking about a program that was back in 2017. So as some of you might relate, we did all this work on the curriculum, got the program going, and right when we were going to implement, our funding was cut. But that's not how the story ends. So back in 2024, we were able to secure some private funding to get back and implement. And so currently, we are operating in Burundi, Malawi, and Rwanda. So since we started last fiscal year, some groups are farther in the process, halfway through the 31 weeks. Some are about to reach it, and some are just starting. So for Burundi, we have 70 adolescent girl clubs reaching 1,750 girls. In Malawi, we have 20 reaching 500, and then 20 new groups being formed. And then also in Rwanda, we have 34 groups reaching 600 girls. We also have a couple of countries adapting the curriculum so for in Rwanda, they're using some of the curriculum in other groups. We're also using it in Kenya and Cambodia in some of our youth groups, pulling from some of those lessons. So at the beginning of the presentation, you heard from a participant of one of our groups. I wanted to show a video at the end of a mentor sharing because we're not just investing in the adolescent girls, we're also investing in these mentors to build their capacity and leadership in their areas. So I apologize for the sound being a little bit quiet. But on that QR code, this presentation will be if you want to watch back.
akamenya n'ikintu agomba gusaba akasobanukirwa neza muri iyo minsi n'ubuvuzi ariho agomba gusaba ukuntu byakira ubona bakiriye hakurikijwe ko biri kose bashobora gusobanukirwa iyo utaragera wenda mu ukwezi k'umugore n'abatagera mu gihe cyo kujya muri uwo muhango ko biri kose aravuga n'ingeraho aramenya icyo abenshi muri bo ntabwo bari basobanukiwe baremereye ejo kurangiza bake muri bo bakize ku mashuri asanzwe ariko basanga ntabwo bazigishyura basobanukiwe ko baratsinze muri ejo hanze basobanukiwe neza muri ejo hanze kuko icyo kimwe uko baranitinyuka akaganira kuvuga ngo bagenzi be yewe tugahana amakuru tukaganira mbese ukabona ni byiza akavuga ati mu ishuri hari ikintu atari kuvuga ariko hano ntakihavuze akadusangiza nkaba umuntu abanzi tutabana muri ejo hanze gerageza iyo wabonye iki gitabo uvuga ati ariko nk'umushinga wacu iki gitabo gisobanuritse ntabwo ati muze twegerana nkababwira nkabasobanurira ubwo n'abakoranye bakagenda baziraho niyumvamo nk'umuntu ushoboye ikindi nkumva nigira icyizere cyane narasobanukiwe yewe naragera muri ejo hanze ntabwo navugaga ntabwo nasabanaga numva uko biri kose numvaga nyamwinshi natavuga nk'ikintu ariko ubu ngubu numvaga nyamwinshi navuga narisobanukiwe mbese nigirira icyizere y'uko numva nshoboye.
Thank you so much. If you have any other questions, you can come up to me afterwards, and I also have these QR codes with the curriculum and the PowerPoint from today. Thank you.
Thank you. You're welcome.
Finance speaker is. Check on two.
Good morning, everybody. I'm Mrs. Shivi Matthew. I head the nurses section in the Christian Medical Association of India, and I'm here to discuss about our experience in nursing education in India in the mission sector. And the topic I've chosen to speak is empowering young women through formal nursing education. And I will be discussing how they become change agents in their community and in their families. So a little bit about the context before I go into the actual experience. You know, India is one of the huge democracies in the world, and India is divided into many regions. And there's huge disparities within India itself among the regions, and there is disparities between health indicators as well as development indicators within the regions of our country. And we always say the South India is shining and some parts of North India keep shining, but there is also quite Bharat within Central India and the Northeast India which struggles with these indicators. So it is in this context that we work. And the right photograph with a map with all the red dots is the distribution of CMI. CMI is a membership organization, and we have 275 mission hospitals across India, and those red dots are the distribution of our mission hospitals across India. And we have 65 schools and colleges of nursing in our mission network, and that's a village from Central India and the School of Nursing, now College of Nursing, that's located in that same locality. Little bit of background statistics. The number of students passing out from our CMA member institutions, those 65 colleges, is 5,200. And the boards, we have 2 nursing education boards under CMA. One is for South and another one for Central India. Both of them have crossed 100 years and they're pioneers in nursing education and founders of nursing education in the country. So when you look at these 2 boards itself, there are huge differences. The South India board, more than 70% of the graduates migrate abroad, whereas in Central India, 95% of our graduates work within their state or within in the Hindi-speaking region of Central India, either in the government sector or in the corporate sectors. So the goal or the objective for my session today is to see how nursing education leads to a transformative impact in young women, and that translates into their family transformations and contribute to economic stability, social empowerment within their communities and personal lives. So I have divided into 3 sections. One is the personal transformation, the second one is economic stability, and third one is the social mobility. It's like a ripple effect where a candidate, when she's empowered with the knowledge and skills and with Christian values and ethics, she emerges as an individual radiating confidence, discipline, and dignity, and a profound sense of purpose. And that further leads into a personal conviction that transforms into channels and agents of change for her own self, her peers, her family, and also challenging the traditional gender roles within their families and the society they come from. So thereby they become the light to their communities, showing the way, and the salt, preserving and passing these values in their families and friends. So when we talk about the economic stability, I told you this, most of our children who study in our mission network come from low socioeconomic and marginalized communities, and combined with the professional training like nursing, gives them 100% job opportunities in India in nursing, so either in any one of the sectors, and that contributes to the financial stability for themselves and their families, and also for the community at large. So when we talk about social mobility, with the nursing is a professional training, and we have different cadre of trainings in India. So this gives them opportunities for higher education, and there is within nursing profession, there is career development. So I told you the students after passing out, they go into government sector or corporate sector, and as they're working, they get opportunities for getting into higher levels of leadership roles. And we have a testimony that the district government officials, senior officials call up our mission hospitals and tell them, please ask your students to apply. There is a recruitment and we want your candidates into our government sector, especially in Central India, because they tell that our graduates, your graduates have not only professional skills, but also they are people of character, behavior and good attitude. So that is the kind of testimonies we hear from the government officials, and it's really encouraging to see how our mission hospitals located in this remote areas are able to make a difference in nursing education and supply good nurses to the community, to the healthcare network, where they become agents of change in the healthcare settings that they are working. So there, and we always, as CMI boards, we emphasize on excellence with social relevance. So we want them to work and preserve their own culture, and in their cultural settings, how can they achieve excellence? So our education and when you plan curriculum, everything is based on this motto, so that they are in the cultural context they come from, how can they work with excellence and be agents of change? These are few case studies that I want to highlight. The first one is we call it's a tribal village. We call it tribal, or here we call them as indigenous communities. There was Adivasi. Adi means beginning and Vasi means inhabitant. In India, we call them, and that is a graduate. After 30 years of community health work in that particular villages, she's the first graduate nurse who's just passed out, and she's going to be the agent of change for the whole 60-odd project, but for the whole district of tribal district, where she has become a hope for the girls in that tribal community to get educated and come forward to do nursing. The second picture is a picture from Bihar, where they call the Muslim community. Muslim means rat, and Muslim in Hindi is rat word. This community out of poverty they started eating rats, and they called a rat eating community, and from a very low socioeconomic background. A Muslim hospital working in that area identified a girl who was in another mission hospital, and that mission hospital invested in her, mentored her, and made sure that she passed nursing, and she's come back to work for her own community. So now she has become an agent of change for her community, leading, and she's given hope for the girls in that area to dream and come forward and to do nursing and to become self-independent and to lead a dignified life. The third picture is also from a project village of another Muslim hospital, where the dancing community, the women are dancers, and they engage in prostitution. So the mission hospital has a project where they rescue the girls from the village, and they have undergone nursing, and now these girls have become a hope for that community. So these are just a handful of testimonies or examples that we have from the hundreds and thousands of the examples that we have, the case studies that we have in our community. And I would like to conclude and leave this with you that although we are like a drop in the ocean compared to the other corporate in the government sector, but still we are making a difference. With nursing education and the professional training, we can empower young girls as they come to us as in 17 years, and they go out at 21 years from us with all these values and ethics and become agents of change in their own families, their communities, and society at large. Thank you.
Thank you to all our presenters. I can see there is great work going on in your regions. And how much time do you have?
15 minutes.
15 minutes. I invite questions, comments, clarification. Take 3 questions and then answer them. Oh, Esther, I don't have an extra mic.
Yeah, thank you very much. I was curious for the first presentation, Youth Ignite, is it possible to get that curriculum that you use? Is that available?
Yes.
Let's take 3 questions then.
Oh, sorry. Pretend I didn't say anything.
I have 1, 2, 3 speakers, is that okay? Okay, the first question, and thank you to each one of the speakers. For Jennifer, just wanted to know about when we talked about your the outcomes. How do you measure your outcomes and at what time frame? And for Mr. John, who are your peers? I just wanted to understand what's the criteria for a peer? That is one. And for the speaker, Amery, is that it?
Yeah.
Amery, just again, what is your criteria for a mentor? Thank you.
Thank you. Those are 4 questions. And for the sake of the online, if you can come up here and answer.
There actually are mics.
Excellent.
Yeah, you can try. If the people in this room can hear, they can hear online.
So yes, we're happy to share our supplement guide, and I could give you my email address. I don't have a fancy QR code, but and whatever else you might need. As far as outcomes go, our plan is to measure baseline and then at the end of the school year. So that would be about 9 months of going through the coursework. We do not expect that the sexual behaviors will necessarily change within 9 months, but we do think that some of those activities and relationships and hope will change.
Thank you so much for your question. Our peers, they come from different youth movement from different denominations. We have our organization is made by 7 denominations: Catholic Church, Anglican Church, Rwanda Muslim Community, the Protestant Council, and 3 others. So if we want to take peers, youth peers, we go from the Catholic Commission. We ask them representative of youth in a certain district or a certain province, then we'll take them a certain number, we collect others from the Muslim community and others from Protestant, and we train them for a quite period of time, then they become the peers, and they do the cascading to their own denominations.
Yes, to your question, usually a mentor is chosen in that area. And so it's typically someone from those community and then it's in the churches, but I can give you more information as well afterwards.
Okay, thank you. More questions? Yes.
To our last presenter, you talked about the Christian values, and I'm assuming these girls don't always come from Christian communities. So how do we make that journey? And are there cases where they don't become Christians, but they still go through the program? And has that been a sticky issue with the donors?
We do not speak about Christianity openly, but we do follow, because in nursing, if you see, all the values and ethics that we learn in nursing are based upon Christian principles. So we teach them those values as a general values and ethics. And many of our mission hospitals do have Christian activities, like they start with a devotion in the morning, and we don't force anybody to follow, but children attend and then they're happy with it. We do not face any resistance as such. But nowadays, with the changing political scenario in our country, we don't emphasize them on attending even the devotion. It is optional for them. But many of but they do learn that we are happy that they learn the values and ethics and go and then they follow it in their life and in the profession wherever they are. So we are more concerned about the values and ethics that they learn from us.
Okay, 3 more questions.
Center, you mentioned that a large percentage of these girls coming to the nursing program come from low economic standing. Do you supplement their training, or how can they come and go to school?
Yeah,
Let's take 3 questions.
Yeah,
and then-
in our mission network, the cost of education is much lower compared to the corporate sector. And in many of the places, the hospital side subsidizes the education on the school side. They provide loans and scholarships so that they can study.
Okay, thank you. Yes,
For Jennifer, I was wondering, and really actually it's for all the speakers, how in this community-based participatory research you encourage people to give honest answers and how you create that safe space for people to be honest.
okay, take some more questions, then you'll answer. Yes.
Thank you to all the speakers. I have one observation. We are engaging a lot of our youth who we very well know are very interested in using media. I think, I could be wrong, but the media seem to be silent in all these presentations. I was just wondering how we are engaging the media to shape the narrative of what we are doing. And then to Amery, your project is in, was it 3 countries?
Yes.
Wondering how Uganda understands. The second youngest population in the world after Niger, that's Uganda. I'm wondering which criteria you use to pick which countries to. Thank you.
Thank you. 3 questions. Okay.
Thanks. This is for all of you, and I wonder, one of the great gifts working with young people is that they have their own knowledge that those of us who are experts often don't have anymore, because we've kind of fallen prey to the Western expertise models. I wonder, through your work, what are you learning from young people, and how is their knowledge, what's the wisdom, the advice in their knowledge that could help us break out of our mental models so we might more effectively reach other young people or communities?
Thank you. We'll start with Jennifer.
Yeah, no, those are really good questions and like hard to answer. Safe spaces. I think how you approach the project and the topic and the kids, the youth, is important. To treat them as equals, not talking down to them, I think is probably most important. And for us, that participatory action, so like doing something and not just sitting around a table talking, was really another helpful way to be both physically engaged, but also mentally engaged. So those would be the things that in addition to like a nice place to meet and respectful teachers, that kind of thing. When it comes to media, that's a really good question. And I would say that's where the poetry and debate came from, especially poetry. There's a local teenage poet that like posts a lot on Instagram, and I think that got them thinking about that. And so it wasn't mentioned, that was kind of part of it. But you're right, how do we incorporate that into the topics and how do we incorporate that into activities is a really good question to wrestle with that we probably haven't done well yet. Wisdom of youth. I think what is so refreshing about working with youth is their belief that anything is possible. And as grown-ups, we get cynical and we say, man, this life is terrible and nothing's going to get better. And they have ideas and dreams, and being able to remind ourselves that, yes, that is true. And how do we support you in that journey and equip you well? And so I think that was my big takeaway from the youth.
Thank you, Marisha.
Thank you so much. I'm starting with this using the media and social media. The media, the social media now in the youth is so challenging, very active and challenging. But remember, we're working in the religious context. What we're going to challenge our youth in the religious context is the different what they are going to find in the media. Of course, in the media, there are a lot of information, challenging information, diversifying information. What we do, we just try to create a good, like thinking, good behavior to our youth. When they go, of course, you cannot limit them to go to the media. We are not going to tell them to go to use the social media. Oh, it's obvious that they are going to use the social media. That's obvious for the youth. But what we do is when they are going to face challenges on the social media, how they can go with those negative thoughts, thinking, and how are they going to respond? We are not, of course, we are not going to teach them to go to the social media. Yes, using social media in the positive way is the keynote. We have to take it and see how we can work with youth, because they are very innovative. They are very innovative than us, they are young, they know how to use the AI. And we are going to take the note that telling them use those positive thinking, those positive solutions, translate them to both be used in the social media. Thank you. And when you come to your question, of course, youth using peer educators, youth to youth, the conversation is very smooth. It's very smooth, and what we realized and what we learned is that when they talk, it creates ownership because they own the conversation and they are truthful. So if there is a problem, it's easy for a youth to refer her peer or his peer to a professional because the problem is this. They can identify easily the problem more than anyone else.
Building on what he was saying for wisdom of youth and the safe space, I would say that having that youth to youth contact, they are more open, and the safe space are determined by the community. And so oftentimes it's a church, but sometimes it's not. For the wisdom of the youth, I think even in the first video that you saw, that the girl was talking about how she went back home to do the garden with her family and that her friends are asking her what she's learned. So there's that sharing of knowledge and explaining like what they might be lacking. Criteria on which countries. So right now we're implementing where World Relief has offices. And we have private funding for. So right now that's Burundi, Malawi, and Rwanda. But hopefully that would expand with more funding. Social media, I might have to get back to you on that one.
I'll tell you about learning from the youth. I've learned a new language. They speak a different language. Even the way they send their messages And he decoded.
Yeah, so I just want to add to the issue of use is very, very interesting. It caught my attention, so I need to add to that. You know, the planning process of every project is about the stakeholder engagement. Because they need to have ownership from the beginning. And most time we, NGOs, we do plan the project without their involvement. All we concerned about is about implementation and getting the process outcome, not the impact. So if stakeholders are not engaged in the beginning, like you said, the youth is very important because they have their own knowledge, they have their own know-how. So if you involve them in the planning process of the project development, move on to the implementation, it becomes easier, they become the owners of that project and meaningful sustainability. And that's why most time at NGO level, we try for donor funding because the project or the program cannot be sustained due to the uninvolvement or engagement, early engagement of the project beneficiaries. So I just want to add to that.
Thank you. I wanted to make a comment and then a quick question about how do you get people to the youth to answer honestly the questions? One thing is, in my experience and study of the topic, start with the less sensitive questions. Do you know anyone who's been sexually assaulted? You don't say, have you been? You know, right? I mean, and even start with more general questions than that, but also the opportunity to answer anonymously, like the dropping the black or the blue stone and the voting or answering anonymously helps youth sometimes to be more honest. So if they can write on a sticky note and then put them all in a pile and people read all the answers later. Because disclosing, a lot of things we might want to know is really much too sensitive to disclose. So people will either not tell you honestly or just not participate, right? So yeah, there's a lot of an art and a science to that. And then I love participatory research and action. And I enjoyed it, all of the presentations, but I'd love to know a current, I'm like, some of what I learned was 25 years ago, and I don't want to date myself too much, but like, do you have resources for currently getting back up to speed on participatory research? I'd love to talk to you after.
Yeah, there's a nice book. Now, it was published like 8 years ago, so I don't know if that's like current enough or not, but it's a nice small one. The last name is Mills, but it's about community-based research. That's a really nice handbook. It's out of Canada. Anyways, but I can give you the specific reference.
Are there any men in the nursing program?
Okay, because I saw pictures men, but it's a very small percentage. The South, we have many opting for men coming to nursing, but also the National Council gives us only a 30% allotment for men in nursing in India. And many of our mission hospitals are training to only young girls, and very few take female nurses.
Interesting, because in my country now, mandate is to involve men, young boys. There's nothing like girls only program, because we think the guys don't know anything when they grow up. So they need to grow up with the same